So the question comes to the 2025 NCQA accreditation. So as mentioned before, this is coming from a webinar hosted by the Assistant Vice President there at NCQA, but there's going to be some shortened verification timeframes, and these are due to actually all take place in July of 2025, so this year. There's shortened verification timeframes, so this change was implemented and was also to mirror the CAQH attestation dates, which is going to be from 180 days now to 120 days for credentialing accreditation and health plan accreditation, and to 90 days for the credentialing certification. So I do want to call out the 90 days for the credentialing certification. As I mentioned, that's just more for CVOs who are handling the 11 verification types. This time frame, 90 days, it's always been shorter than, as you're seeing above, that 120, because this certification is for those who are having to provide data to other health plans or other delivery systems. So the reason, if you are NCQA certification holder, your time frame as well as having those verifications in is shorter, because you're typically providing that information to other organizations. For them to be compliant, they need the data quicker. Okay. So the second one is changes to the credentialing application. So as you know, in the world of NCQA, and just like think about it from a directory viewpoint, there are two new requirements related to provider race, ethnicity, and language. The first is required fields for this, the information on the credentialing application. So there are going to be options to where people can have and include, like, opt out of providing that information. You would just have to have them sign and attest that they wish to not provide that information. But the purpose of number 2 is trying to enable healthcare systems to attain the information as soon as possible to support provider directories. So the essence of providing that information will help members be able to select specifics of a provider type that essentially meets their needs. The next one here is going to be the new ongoing monitoring requirements as number 3. So there are new requirements for the accreditation and certification, and it's related to exclusions monitoring. If you are an organization that has Medicare or Medicaid under your belt, or any type of government payer, you're most likely following the exclusions monitoring requirements, but NCQA has also added this. And they've also added to include the SAM.gov as part of their exclusion checks. There are requirements to check the Medicare and Medicaid exclusions as they were previously before. And then all exclusions need to be checked at least monthly, so within 30 calendar days. So the purpose of this one is to make sure that you have providers who are maintaining compliance. If you're a government-funded program, that the funds are being allocated to providers who meet the requirements of having an active licensure and no stipulations or sanctions on their records. And that's being able for you to monitor and maintain that and then report accurately will help you meet that new ongoing monitoring requirement. And then for number 4 here, there are changes to system control requirements to the information integrity standard. The basis of this, in short, many of the requirements were clarified and scopes were more clearly defined, like the training requirement was added, meaning that people who are going to be holding the certification, they meet a certain requirement from NCQA, but there were public comments noted that at a high level, changes were done to replace system controls with information integrity requirements, meaning you can't alter a licensure and add your own information on it, or scan in a PDF and change an expiration date to help you state that provider was licensure active. Those are like the integrity requirements that are in place. And then this change allowed for more frequent audits. They moved a must-pass requirement to policies and procedures. They adjusted a look-back period requirement where appropriate. They also specified inappropriate documentation, as I mentioned, as like altering of documentation. And they also noted some updates and changed delegation oversight standards. So on this system changing control requirements, I do strongly encourage that one, you visit your NCQA manuals or your NCQA representative who can kind of go deeper on these, because they're going to be more specific to you and your organization and the level of care you're providing. So that's on number 4, the changing system control requirements.